Hi everyone, just wanted to go over a few quick items from our week 6 quiz. I realize we're at the end of week 7, but remember everyone had until Friday night to get their quizzes in due to the delay with the textbook material, and I was still missing one as of yesterday afternoon. So now everyone has their quizzes in, so we can go over a few of the correct answers. So, first question, in order to resolve inequalities and inequities in the healthcare system, we must consider which of the following. And this was a choose all that apply question, so you need to choose all of those that are accurate. Now, what I will do, and I have not done this yet, but I will go back through and give you partial credit if you answered some of them, maybe only answered one or two instead of, all three that were correct, but I haven't done that yet. If you answered the ethics of health policy, that was wrong, but horizontal equity and vertical equity are both correct, as well as differences in outcomes. So when you think about horizontal equity, think of a horizontal line. So a horizontal line, that's going to be across a population. So, we're thinking of equity across the population, and I think probably one of the best ways to look at horizontal equity are countries that have universal health care. So, let's say Great Britain. Everyone in Great Britain has universal health care. It's a socialist system. It's paid for through the government, etc. So that's horizontal equity because everyone, regardless of where they are in the socioeconomic scale, has the same access that everyone else does. Now, there are some inequities, or probably more inequalities, not inequities, but there are some inequalities with regard to folks that do have cash to pay for expensive things that perhaps, sometimes maybe someone would have to wait 6 months or a year to have an elective surgery. But if they can afford it, they may get on an airplane and fly to the United States and have surgery because they can pay cash for it. So there are some inequalities there, but they're not necessarily inequities. And we'll talk more about that in a little bit. Vertical equity is that, so think of a vertical line up and down. And that's where there's equity in our case, we're talking about healthcare. So there's equity in healthcare based on the needs of the population. So let's say someone like myself, I have private health insurance or a group health plan through RMU now. So I have that insurance through RMU. I can access a wide range of providers through the UPMC health plan network because that's what we have. And so that's equitable to me. But then take, for instance, somebody that kind of falls in that hole between being eligible for Medicaid, which is based on income, low income, and having a job that offers benefits. So if you fall into that hole, you don't necessarily have equitable access to healthcare, health insurance, and healthcare. And that's where the Obamacare plans or the Affordable Care Act plans were looking to close that hole because they were providing what was hoped to be reasonably priced insurance products through the health exchanges that folks that did fall into that space could pick up and be able to manage the premiums. Unfortunately, the premiums are still quite high, and many people can't manage them on a salary from a position or from a job that doesn't offer them benefits, because typically if you're working in a job that doesn't offer benefits, it tends to be on the lower side of the pay scale. So that is vertical equity. We have some inequities in when we look at vertical equity across our healthcare system in the United States. We also need to look at differences in outcomes. So trying to resolve those inequalities and equities, some of those things that I had just spoken about with vertical equity, looking at differences in outcomes. Okay, so for those folks that fall into that kind of donut hole, that maybe have to go to receive care at a free clinic, are their outcomes different than if someone has a Medicaid product or has a Medicare product or a private health plan and they receive care? So what are the differences in outcomes, and what can we do to resolve some of that? So those three are correct. Ethics of health policy doesn't really apply here, so that is not one of them. Like I said, I'll go back through and adjust the grades and give partial credit if you did answer some of them correctly. be aware that not all professors do that. So think very closely about about choosing which answers are appropriate. There are some faculty that, and actually, I guess it won't impact you guys at this point because you're at the end of the road. But there are some faculty that won't give back. You have to have them all right, or you don't get points for that question. So if you go on to do another master's degree or a doctorate, etc., just be aware of that fact. Especially in the healthcare realm. I think that a lot of healthcare folks feel that it needs to be right. So, and if you're in a field where like that requires a certification exam, like healthcare compliance, nursing, physician practitioners, etc., board exams, certification exams, they would not give you partial credit on anything. So I think that's tends to be the realm. We don't do them a lot in our program, so I do tend to give partial credit. Next question here. The ethical principle of autonomy conflicts with what public health and government approach to protecting the public? So we talked a lot about in this, and actually in past weeks in class, about paternalism. So paternalism is kind of like that. You think about when you hear the word paternal, that's like dad. So think of dad. The paternalism is like dad watching over you, taking care of you, making decisions for you. So, back in the past, and actually still now sometimes, especially under this current pandemic, the government and public health are kind of being our dad, saying, okay, you need to wear a mask, you need to make sure you wash your hands, you need to stay 6 feet from people. That's paternalism. It's not a bad thing. Sometimes it is when they take away our rights. In this case, it's not a bad thing because sadly, I can tell you two short stories. They'll link together. Yesterday, we were at an event at a location, and there was a line of people, and there were markers on the ground, and you had to stay 6 feet apart, stay with your party 6 feet apart. And all of a sudden, this person in the middle of the line just takes their mask off, is going about their business. It wasn't like they were eating or drinking or anything. They just took their mask off. This was indoors, took their mask off. And I just kind of moved a little bit further away from them, and I was going to mind my own business. They were right behind me. The person behind them decided that they wanted to be paternalistic, I guess, and told them to put their mask on. And it actually almost came to blows. We were very fearful. We had to get a staff member to come. We were fearful that they were going to start actually fist fighting over wearing a mask. So then today, I actually got an airplane and flew back here to Pittsburgh. I've flown now probably 5 times during this pandemic. Because we're doing this move back and forth to Florida. Today was the absolute worst. The plane was nearly full to capacity, 3 seats on each side. Most people, as they were getting on the plane, had their at least their nose sticking out of their mask, if not just had the entire mask down under their face. And it was the first time that I really felt unsafe on an airplane because there was no social distancing. Luckily, I did have an empty seat next to me. There was somebody on the window and I was on the aisle, but the row in front of me was completely full. The row in back of me is completely full. Next to me was completely full. And these weren't like it wasn't a party of 3. These were people that were stuck sitting next to one another. And so there's a reason that we have this paternalism. And they, throughout the entire flight, it's 2 hours, the flight attendants must have said, I'm going to say probably no less than 15 times, you need to keep your mask on above your nose, from above your nose to below your chin, because people just can't follow the rules. And as a former compliance officer, not following the rules is not acceptable to me. But in this case, it's really about keeping people safe. You wear a mask to keep others safe. People wear masks to keep you safe. It's about respect. If the other people on the plane are wearing their mask, they're keeping you safe by doing that. And if you're not wearing your mask, then you're just a jerk. But so it's but the paternalistic part of this is the government follows the research studies and whatnot that have shown that at least a minimum of a surgical mask or 2-ply cloth mask is effective at stopping the aerosol spray of this virus if you are wearing it. And so by sharing that information with us and saying, yes, you need to wear your mask, they are being paternalistic. So it's an important point. I don't think people necessarily see it as an ethical principle, but it is. It's not just the government telling us what to do. It's that ethical principle of paternalism. Some other folks chose beneficence, and beneficence is about doing good. So it's not, beneficence is certainly not in conflict with autonomy. Paternalism is, because autonomy is I do what I want, when I want, wherever I want. It's my rules. I have the choice. Whereas paternalism is, well, sometimes you need to follow other people's rules too. And that's what makes a successful society, which we aren't right now, unfortunately. So, today was just yesterday I said it, and today was just another example of that. So I'll be glad when I don't have to fly back and forth very soon, hopefully. Only a few more trips back and forth. Okay, next question. Morally unacceptable differences in health status across a population or populations is. Almost everybody answered health inequity or health inequality. So health inequity and health inequality are different. Health inequity is what is defined in this question. Morally unacceptable differences in health status across a population. So, we kind of talked about inequity already. Let's say that vertical equity issue where I have a job that, has health insurance. Maybe my husband doesn't have a job that has health insurance. And so I have access and he doesn't. And that's inequitable. What's morally morally unacceptable is when there's a group of people that just simply don't have access to health insurance, have access to care. That's where that inequity, it's morally unacceptable for us to leave people within our population without being able to access health care. It's morally unacceptable. I think most people would agree with that. Health inequality is a little bit different. It's kind of the same, but there's no moral judgment with health inequality. So I think the example that's listed in the textbook pages that we had was about cosmetic surgery. So think about, cosmetic surgery. Not everybody in this country, me included, maybe some of you can, but certainly not me, can afford to have cosmetic surgery. I'd like to have some, but I can't afford it. So there's inequality there. Some people can afford it, some people can't. Is there a moral issue there? Absolutely not. There's no moral issue. But inequality means there's a lack of equalness or fairness across the population. Not everybody gets to have this, but there's no moral judgment. Same with any type of cosmetic or completely elective, not medically necessary type of procedure or service or any of those types of things. That's inequality. Inequity is when it's truly affecting the health of that portion of the population. They can't access care. They can't go get a COVID test. They can't get, screening exams for cancers or physical exams each year. That's inequity. Everybody should be able to access that type of service, and not everybody can. And that's what creates that inequity. So inequity, morally unacceptable differences, inequality, just differences. Last one. COVID-19 is one of many epidemics to occur within the 21st century. So our answer here was true. There was a whole listing of them in the textbook, different SARS, MERS, Zika virus. There were probably 15 of them listed. They didn't list COVID because this isn't that new of a textbook. There was a coronavirus listed, but that was SARS. Coronavirus is really, the common cold is a coronavirus. The coronavirus that we're dealing with now is a very specific, a specific version, hence the name COVID-19, which is coronavirus disease 2019 or something like that is what COVID-19 means. But it's a very specific type, but we've had other coronaviruses. The SARS virus, which you may remember, didn't hit us too badly in the United States, but really did a lot of damage in Canada and specifically in Ontario, which I was very close to at the time because I lived in New York. So that was very bad for them. Zika, obviously, in warm climates because it is transmitted via mosquitoes, and was really hitting hard Central America, South America, Mexico, down in more warmer climates, the islands, etc. So lots of epidemics that have occurred, sadly. This is obviously the worst, one of the worst we've ever seen in modern times, but certainly the worst that we've had within the 21st century. So that's it. I won't go over the work for the week because obviously, hopefully you've completed most of it already. Hopefully you're getting your final projects and whatnot ready for submission today. I think tomorrow, I'm pretty sure, I don't have my calendar open, but I'm pretty sure tomorrow is the live session where you'll present your projects, and so that'll be good. I look forward to that. And just hearing a little bit about your project, what you chose, all of that good stuff. So I guess that's it. Any questions, please reach out. We will have a short Ed Puzzle next week as well, just to go over the week 7 quiz, but I'll try and keep it short, and then we'll go on from there. Don't forget that class ends on Friday, so a week from this past Friday. Again, I don't have my calendar, so I don't have the exact date, but it doesn't go through Sunday. It ends on Friday. New classes start on Saturday, which you guys generally, most of you don't have to do. This cohort is done as of the end of this month or the end of this term. So congrats to everyone. I'll see you all later this week for your presentations on your internships. So thanks much, and have a great day.